Welcome to the Feds, insiders bringing accountability, integrity, and reform to a broken bureaucracy. At Feds for Freedom, we value constructive dissent and healthy debate. The views and opinions shared in today's episode are those of the speaker alone and do not express the views or opinions of the U.S. government or any other employer.
Welcome back to this week's episode of The Feds. I am Stephanie Weidel. Thank you to everyone who listens to our podcast on a regular basis and to those who share it. We can't do it without you. I got a LinkedIn message the other day. Dave wrote in, "Thank you for what you are doing with Feds for Freedom. I just watched episode 70 with Francesca regarding IGs, or Inspector Generals. As a retired Army general, I couldn't be more in agreement with the views both guests expressed. Please keep up the good work." Thank you, Dave, for that encouragement. Keep the comments, likes, and shares coming. This week on The Feds, I am joined by Dr. Sheila Furey, Virginia Medical Freedom Alliance, or VAMFA, co-founder, and Valerie Borak, attorney and policy director at Stand for Health Freedom. Feds for Freedom is co-sponsoring the VAMFA conference at Liberty University on Saturday, April 5th. The conference is titled Medical Freedom and the Constitution, Your Life in the Balance. Go ahead and register to hear some awesome speakers talk about the Constitution and your freedoms. Valerie is one of those speakers. Welcome, Sheila and Valerie. Thank you so much for joining me today.
Thanks for having me on.
Thank you for having us.
So, Sheila, I want to start with you. The title of the conference is actually a really interesting one. Medical Freedom and the Constitution, Your Life in the Balance. So for all fighting against the COVID vaccines, the First Amendment was the strongest argument out there, the right to religious freedom. What kind of medical freedom does the Constitution afford?
Well, specifically, it is the right to life and your independent bodily autonomy. And what we saw in COVID, and we've seen it throughout history, is medical decisions being mandated by law. And we see it in the childhood vaccine schedule, but it became evident to everyone with the mandates around the COVID vaccine. But it is beyond that, because we have a medical industrial complex. So the hospitals, the insurance companies, the pharmaceutical companies that make really profound decisions about our life, and often without true informed consent. And this is why being in a forum where we can discuss how the patient needs to be empowered to stand against the industrial complex and make their own life decisions and understand fully the decisions and the rights that they have as individuals, rather than simply being told what to do by the hospitals or the physicians or other practitioners.
So where does the right to refuse medical treatment, where does that come in? Because that's not specifically stated in the Constitution, is it?
Well, and you have a right to bodily autonomy. Okay, so people cannot do things to your body without your consent. That's called, and Valerie can jump in here, that's called battery. All right. And that we have religious liberties, and we have a long history of religious liberty, especially in the medical community, of accepting people's right to refuse medication, to refuse blood transfusions, to refuse surgery, to refuse other interventions, even though the consequence for that refusal may be their death. And if they have that belief, being in a country where we honor and respect that belief, right? The government has stepped in periodically in reference to children, and it is usually in reference to children, and saying that if a blood transfusion in particular will save the life of a child, that it will be done against the wishes of the parents. That is not, it depends on the state. And Valerie, you might be able to speak to those rulings. But in general, we respect parental rights over their children and the well-being of their children. And that's an international respect for parental rights. And yet what we have seen this eroded on a tremendous, to a tremendous degree, particularly in COVID, when we saw children being given the COVID shots without parental consent or against parental consent.
That's right.
And so being able to talk about all of these issues in a forum is critically important.
So I think Sheila hit the nail on the head and articulated things really well. And I think another context to put around this conversation is just taking it way back and, what is our Constitution? What are our rights? And these rights that the Constitution enshrined with the Constitution and then the Bill of Rights, of course, these are our God-given fundamental rights that we're talking about here. We're talking about our bodies. We're talking about our spirituality, our relationship with God. We're talking about our children, our families. And so, when we go back and look at the history of the way our country started and what the founding fathers were doing, we have this radical, amazing experiment in protecting those God-given rights. And so the Constitution didn't say that the federal government allows us to do these things. The Constitution was created to protect us and our relationship with God. When you look at those source documents back in the day, the reason we have the Bill of Rights is because not everyone was sold on the Constitution. We were in a situation where we had just fought a war for our liberties. And so why would we? If you're a farmer and you've just, gone through this situation in, this revolution, why would you then say, yeah, sure, let's have some government now here? So this was really one of the things that people protested to and were wary of, was that the Constitution would come between them and their relationship with God. And so this is why our Bill of Rights was created, and our First Amendment protects religious liberties. So, of course, the religious aspect of this is very important when we talk about all these medical freedoms. And there's a bigger context as well with freedom of speech and privacy. And, that ties into your ability to raise your family in the way that you want to. So I think that that's just, that's kind of an amorphous, but like a big picture answer of, how the Constitution protects us, because the Constitution is protecting, and the Bill of Rights protects what we already have. And this is not something that other governments really use as an approach. And so I think that's a fundamental thing here. So when we do have Supreme Court cases that speak to both the medical rights like Cruzen, and there are cases that speak to the parental rights. And so, like you said, this isn't written directly into the Constitution, because there were understandings and presuppositions then about what we were doing and what we were protecting that we may have lost sight of nowadays.
And I just want to add to that, Valerie, is that to specifically look at this and say the Constitution and the Bill of Rights were constraints on the government. And I want constraints on the government, because their biggest fear was that the government would be, why did they fight this war? And where we're going to end up in the same situation we were in before, of the countries that we left to achieve freedom.
Yeah, what a gift it is, that Bill of Rights. So although the COVID-19 vaccine mandate or shot mandate is behind us, how do you see our medical freedom threatened in 2025? So Sheila, I'll start with you and then we can go to Valerie.
Well, the mandate has stopped in one respect, but we have not stopped medical mandates. We have medical mandates in every state for the childhood vaccine schedule. We had until the Trump executive order that we had private colleges and that were receiving federal money still mandating the COVID shots for students, but not faculty and staff. And we also have significant mandates on our military. And this is really disturbing. The military has really become enlisted men and women have become guinea pigs for research on the large number of vaccines that they receive when they enter the military. That's also disturbing to me. We also have what I consider a lapse of true informed consent. And that when patients enter the hospital, they are told essentially what the hospital wants to do and not given options, not given alternatives, and not even being able to ask questions without irritating hospital staff. And it's disturbing to me that so many patients have to ask for a patient advocate in order to get their questions answered. And that the physician or other healthcare professionals will simply say, well, this is what I'm going to do, rather than having the patient make a true informed consent. Equally, there is the push, and in many states, we have a medical assistance in dying bill, all right, or MAID. And so what is happening is that people who are compromised, particularly medically compromised, are said, well, you don't want to be a burden to your family. We think it's your turn to take the little blue pill. All right. You can't have the government and employees of the government who have a vested interest in your death, not your life, pushing you to make end-of-life decisions, and often without true consultation with the family. There is appropriate end-of-life care, which is often being not provided in favor of medical assistance in dying. And this places so many people at risk, particularly the mentally ill, the handicapped, the vulnerable. And what we know from Canada, very disturbing data. There was an Olympic athlete who was a paraplegic and a veteran, and asked for a chairlift. And instead of providing a chairlift, they asked her to participate in medical assistance in dying. So this is
When was this?
Yeah, this was a number of years ago. All right, just within the last couple of years. So their program is rapidly expanding. They've even expanded it to say that if you're poor, that's a reason to have medical assistance in dying. And this is where I think every person of every faith needs to step and say, no, we are a country, and we are countries that are based on how we care for those who are most disabled, most vulnerable. And yet, this is passing legislatures in record numbers because it's convenient. And I don't want medical care to be convenience. I want it to be a life providing, a life embracing, and even life embracing in the moment of death.
Yes, agreed. Now, you mentioned informed consent. Valerie, what laws are out there that ensure informed consent?
That ensure informed consent. So we have, the first thing that comes to mind because of the topics we're talking about, we've got the 1986 law. For context, what that means is that in 1986, there was a law that was passed, that the National Childhood Vaccine Injury Act, that enshrined the liability-free products that are being mandated. It enshrined that lack of liability, but it also, in the text, required things like our VAERS reporting system, and also required that vaccine information statement that is supposed to be presented to people when they are confronted with it's time to vaccinate conversation. So this is something that is enshrined in our law that's supposed to give us informed consent. But I can tell you that it's woefully lacking from my point of view, and also specifically has been reduced through the years. There's, I believe it was the year of 1993 where they revamped the information that they wanted to have on the vaccine information statement. There was a big conversation about how much information is necessary, which of course is, that's an important question to have, because what is it that a person needs to know to truly be informed? So that's a medical question. It's an ethical question. It's a legal question. It's very, very important. And so at that time, though, the policy decision was that we're giving people way too much information. They can't digest all of this information. So we're going to scale back what's on the vaccine information statements, because they don't need all of this to make their informed decision to just say yes to these shots that we're saying that are recommended. So that is one place where we've enshrined informed consent. I think a lot of it is through case law. And like Sheila had mentioned the cases before where if the person wanted to decline blood transfusions and different, there are patients' rights cases that you can look at through the years where that concept of informed consent got enshrined based on those constitutional doctrines that we were talking about earlier. So I'm struggling to come up with an actual statute other than the vaccine information statement that's required because most of it has played out in case law.
We also have the Nuremberg Code and other codes of ethics that have guided us. So we had significant experimentation on human beings that occurred during World War II, but it wasn't limited to World War II, as we know because of the Tuskegee trials in which they injected men with syphilis and they did not give them any informed consent. They were part of a medical experiment that went from 1932 until 1972. All right. And it wasn't until it was exposed. These people and their communities suffered great harm because of what was done. Even after penicillin was discovered and there was a cure for syphilis. All right. And this was not the only medical experiment that occurred without any informed consent. And then what we saw, you have to have understanding of an experiment or a procedure, and you have to say yes to that procedure without coercion. So what we saw in COVID was people being said, we want you to do this, and if you don't, you'll lose your job. All right, so people were forced to make decisions about providing for their family and taking a shot that potentially could end their life. But we were told it was safe and effective. Well, it was neither safe nor effective. And so the FDA has also created lax guidelines where if they want to have ongoing experiments and they deem that there is minimal risk to you, then they can do those studies without your consent. This is very disturbing. And even if it's collecting data, all right, I don't want my data collected by an anonymous source without my permission or my consent, and that I can review it. And I can review all the data that you're collecting. So they make data gathering seem benign. It is not benign. And we need to stand up to this.
Yes. I liked that little slip of the tongue there with connected versus collected, because that is the key there. Exactly. So when you had asked the question earlier about what's the biggest threat to our health freedom now in 2025, this is exactly what was at the forefront of my mind with informed consent in mind, but also the data collection and the digitization of all of our lives, not just our health data, but our personal data and all of that becoming interconnected, because we've got, to tie back to that informed consent question, one of the challenges that we have for informed consent is that we're getting less and less information because doctors, as Dr. Furey just said, aren't able to go down that path of the practice and the art of medicine anymore, because we've got this situation where everything's turning into an algorithm. We have, in this age where we ended up with, HIPAA. So you go back to the Clinton administration and you look at that failed kind of universal health plan, the Global Health Security Act, I think it was called, Global Health Act. And he wanted to have this health plan that failed. And after that Clinton health plan failed, this is where we got HIPAA and we got digital records. So when the federal level plan didn't go through, that's when the digitization of everything that would have been passed as a federal law just kind of moved to the executive agencies instead. And we have these laws about, HIPAA, for example, the P doesn't stand for privacy. It stands for portability. So these laws that we're being told in a very Orwellian way are protecting us are doing exactly the opposite. There's so much information when you start going down this path to learn about how HIPAA is about transferring information for, in theory, for payment, but there's also for research. There's like 100 exceptions, so to speak, to HIPAA. Like HIPAA is more of an exception to your privacy practices than it is to actually keeping things private. And, this is relevant to what's happening in 2025 because, any of this kind of digital age, the groundwork had to be laid. So this is where you start seeing the infrastructure and technology in our federal government and in health systems. And once you've got, this procedure code and this diagnosis code, then doctors have to practice to those codes. And then they end up having, and I'm sure Dr. Furey can speak to this better than I can, but there's penalties. If you choose to go outside of this code, you're not going to get your insurance payment. If, you're reviewed, then you didn't follow the protocol that we want you to fill. And we can even take this even further back to the theories of, germ theory, basically, because even though that's a kind of biological world thing, and now we're talking about the digital world, ultimately, if you want to talk about technocracy, the goal is to merge it all. But germ theory is that same mentality, the one ill, one pill. If we can categorize it, we can control it kind of thing. And so the I can't say that word at all today, digitization of everything comes from that thought process and was the natural outgrowth because you want to have this control and you want to merge this, you want to turn the humans into a machine and understand it that way. And so that's the way that informed consent is getting eroded in that sense.
No, for young Americans, like these students that we're going to be speaking to at Liberty University, they've grown up in this information age. I mean, myself too, all of us. I mean, we've grown up in this information age and some don't really see a problem with it. They say their entire lives on Facebook. They're happy to give whatever to make their lives easy. Would you just speak about why it's a danger to them?
I got a good one for that, if you don't mind, Dr. Furey. So we published an article a year or two ago about a program that was happening in Chicago at the university. And it was it's referred to as SHIELD T3. And it was this testing for COVID, a rapid test. But then at the same time, they were also using, on your phone, you would have your access to, your QR code to access buildings and things of this nature. And so just imagine that, you were feeling a little sick. You decided you needed to do a rapid test because you're trying to, be cautious. And then you don't have the results yet and you're okay. You might think you're okay. And then you go to a building to get to your class and you can't get in because your access is denied because your QR code is linked to that test that you haven't even gotten the results of, or it's linked to someone else's test that you might have been around because of these, the way the phones are doing the contact tracing. And so you might have been around somebody that thought that they might be feeling ill and went to get their rapid test and you go to get to your class and the door won't open for you. I mean, there's also, you can go down that even further because there are states that are looking to link they're encouraging the residents of the state to put their license into their wallet, their digital wallet. And so once you linked that personal information and we've created this infrastructure for having all of this data connected, this is where we're going to be affected. I mean, this ultimately is right now we're looking a lot at what's going on with the REAL ID. And this might mean nothing to like the kids, the young people in the audience yet, but it absolutely will. And I think this is a really good platform for them to get involved in because right now, so REAL ID is if you look at your license, you might have a little star on it. Most states, they don't even ask you if you want one. You just go to get your driver's license or your identification card. They just make it a REAL ID, which is a federal program that started in 2005 that passed in those, suite of laws that came up in the Homeland Security bills to make our country safer after 9/11. And so this was kind of a sleeper for a lot of people because it was about 20 years before the federal government got each state to adopt it. So it's a federal program, though, that each state had to link into. So when you go to get your state license that used to be completely managed by the state, and the state would vet you and make sure that their citizens within the state were safe, now it's being sent to federal level databases. And this, when you look at the regulations, you'll hear about it as if you don't have your real ID, you can't fly after May 2025, and you can't get into a federal building. But the regulations specifically say, this is where we're starting. There will be more things linked to real ID. So if you have a real ID in your wallet right now, that's cause for concern.
Now, my license needs to be renewed. How do I uncheck the box of, no, I don't want this to be made into a real ID?
That's going to be dependent on your state. So there might be a little, I don't know if you have a digital or paper form, you might be able to simply uncheck, or you might have to actually just talk to them, because the people who are working at the motor vehicle department might not even really know what this is about. Because I can tell you, I definitely got a lot of looks like I had grown another head when I went into my state. I'll say I'm in Maryland, and I said, I don't want a real ID. And long story short on that, it turns out Maryland is a state where you can't opt out. So there are 5 states in the country where you cannot, they don't provide an opt out. But
So what did you do?
Well, I guess I'm not a resident of Maryland yet. I've been working with my lawmakers to see if we can change this law, or that we can delay the implementation of the real ID.
Wow. Sheila, do you want to add more?
Well, I want to add that I think college students are beginning to wake up, and particularly around health and their own personal health, and beginning to take concern about the food that they eat, what they're exposed to. I think the EMF, some of them are waking up about that and the amount of digital exposure and Wi-Fi that they have. And we do have a group of students who are very up to date and say, okay, hold it. Can we back off on this? But I think the health movement, particularly with the athletes at colleges, has really taken a hold, and that they're wanting to ensure that the food that they put in their body is good, healthy food. The other movement I'm seeing is among young women, and this is really, I think, empowering. They are stopping the birth control pill. So as we had the sexual revolution in the 60s and 70s and wanting to put everyone on birth control so that sex was free for everyone, which was a lie. We know that sex is not free and has significant consequences, even if it isn't pregnancy. But they're beginning to see that the disruption that it has caused in their menstrual cycles for them personally, emotionally, and looking at the long-term consequences of that. The fact that college students are waking up about this is really, I think, something to be celebrated and applauded. That they are going against the medical establishment that says, oh, this is safe, there are no long-term consequences. And the young women are saying, no, there are long-term consequences, and I don't want to be a part of that. I don't want to jeopardize my fertility. I think that's a wonderful thing. And so I'm really excited to be with this group of students.
Yeah. The idea of hosting this conference at a university, that is just absolutely brilliant, because these are the next lawyers, the next moms, the doctors, federal employees, even though the federal realm is paring itself down, and the next podcasters. I mean, what's interesting and what I hope can be brought out at some point to these young folk and to everyone who attends this conference is, you can look at the world. We are taught in America to look at the world through this 2-party political lens, and it just simply is a facade. There's more to the world than 2 parties. There's more to the political realm even than these 2 parties. And so to not align yourself necessarily, like, don't take yourself and say, okay, I need to fit in one of these 2 categories and go along with what they tell me to do. but know your principles, know your Constitution, know your Lord, and you can align yourself with the one that follows those principles. But then if those people stray, then you speak up. You have the duty to say something. So I'm looking forward to an opportunity to say that, for someone to say that, and also to talk about government overreach, what it looks like, what can be done about it. And basically it's you think, you research, you pray, and you stand up. So I'm really excited about this opportunity to speak to everyone at Liberty. It's an exciting time.
It truly is an exciting time. And I think you're absolutely right that our decisions, there is not a perfect political party, that our decisions have to be rooted in our faith, in our Constitution. We have to be guided by those principles. And what is wonderful is that we have a lineup of speakers who have spent a lifetime dedicated to those principles and standing up and risking a lot, their careers, to stand up to the establishment for the greater good, for God, liberty, and freedom, and recognized how critical it was for us to really become, as Ronald Reagan said, the shining beacon on the hill. We have lost that light and we need to reclaim that light. And it isn't by giving a handout to everyone. It's by being a moral example to the world. That's what our role is. Our role is to be a moral example to those around us. And that's what makes this opportunity so wonderful, is because these leaders have done that for careers.
Mm-hmm. Now, I know that Vice Admiral William Dean Lee is going to be speaking, as well as Christine Dolan. So what is the Vice Admiral going to be talking about, and Christine Dolan? She's an investigative reporter, correct?
Yes. So Vice Admiral Dean Lee has been he was in the U.S. Coast Guard and was essentially in charge of the U.S. Coast Guard from the Rocky Mountains eastward and southward to Europe. All right. So much of the world. And he is an example of leadership. And he saw in his career the impact of diversity, equity, and inclusion, or otherwise known as did not earn it. All right. And he saw the impact of the transgendered movement in the military and what risk that places our military in. And if our military is taking risk, then our nation is at risk. And he's able to speak about what it means to be a leader and what it means to be a leader against the opposition. So it's really exciting. He's a dynamic speaker. He's a dynamic person, and I can't wait for everyone to hear him. Christine Dolan has been an investigative reporter for her entire career, and she has done the deep dive into human trafficking worldwide. And what she has now opened the door to is how medical trafficking is an open door. And so how many of us have, and did COVID open the door to medical trafficking? Are we just an experiment for a pharmaceutical company? Are we an experiment for a hospital? Where are the lines drawn? And how are the most vulnerable in our society potentially being trafficked for the purposes of human experimentation? It's disturbing things. And she has the ability to tie all of this. She's our last speaker of the day, but her job is to take all the speakers before her and tie them all together in a nice little bow for the audience. And she's really going, once the interaction of the students She's led student events before, and we're really excited and grateful that we have her joining us.
Oh, wow. No, you mentioned human trafficking. I know that our president, Marcus Thornton, has dealt with this in the past with his career. So I'm sure he'll be very interested hearing the connection with medical trafficking. I mean, I've never heard that term before, and I'm sure most people have not. Um, so that's fascinating and makes you really think. Now, Valerie, you are an attorney and serving as the policy analyst for the nonprofit Stand for Health Freedom. So, would you tell us just briefly what Stand for Health Freedom does? And then I want to talk about your topic for the conference.
Yeah, sure. So Stand for Health Freedom, we exist to support states in their fights for medical freedom. So basically, if I could say it succinctly, we educate and we mobilize. So within this movement, this health freedom movement, we are able to have changes affected on any level of government. We build a network that we trust, that we can interact with, that we can network together to make changes happen either in a local government level or all the way up to the federal level. And of course, this last congressional session, we were looking at things like the pandemic treaty, and so we were trying to work on even that level as well. So we exist to support states in medical freedom. We have about 700,000 advocates on that take action through us. So we're really growing fast, which is a testament to the power of this movement.
Wow, 700,000 advocates. Wow. So, all right, you're going to be speaking at the conference about vaccines and the Constitution, two things you know really well. What is the history behind the recommendation of childhood illness vaccines?
So the history, to sum it up in a nutshell, basically these recommendations started out as we'll say, national security interest with the military. And then over the decades changed into kind of got wrapped up in the women's movement, and that became an economic argument. And also all of it is predicated on the germ theory, because if we don't have germ theory as our predominant idea, the vaccine structure falls apart entirely. So we have the military in the time of, around the World War I, this is when we had the Spanish flu, that first influenza that was pandemic. And that was horrifying for everyone. We had this war where people had just died. We had more people dying from the flu than we did in combat. And so this was a military need. It wasn't just the influenza, but there were other illnesses that would affect soldiers, tetanus and, other things where they would, smallpox, that the military would take a huge hit if there was illness that went through the barracks or went through, all the soldiers. And so it was a military need for us to figure out how to nip this in the bud so that we could have a stronger force. And so influenza was, of course, one of the first, because everyone was afraid that this would happen again, that Spanish flu would happen again. And so the next thing, though, is that the military, once, of course, we created this vaccine, we were giving it to our military, we're successful. The military, these vaccines also get mixed up in patriotism, because, once we've got more and more vaccines that are coming down the pike, now we've got to be a strong country and we've got to do this. Our soldiers are fighting out there. Let's make sure we're fighting at home to keep ourselves safe and healthy, so to speak. And then, we've got the post-World War II era. Things are looking up. Things are really lovely, but there's still research being done on these vaccines. Mumps was one of them that actually was really challenging for the military. If people, especially males, got it later in life, it was really debilitating in certain ways. And so this research continued to go on. So measles, for example, there was a military program that started, but the one that ended up being licensed did not. The military couldn't come up with one that was safe enough to give to the general public. We had the measles and mumps and the rubella vaccine that came together, and these all came out of Merck. Ultimately, there were different people who were making them, but rubella in particular is basically the reason that the MMR exists, because there was the idea, that the reality, that, like Sheila was talking earlier about how medical treatments and even experimentation can happen on our most vulnerable. And so there was a point where an ophthalmologist from Australia made a link between women that he had coming in and he was treating their children with congenital eye issues. And he overheard their conversations in the waiting room where they said, oh yeah, I had rubella when I was pregnant. Oh, I kind of did too. And so he put together this link and published this paper that was laughed at the time for a little bit. And then all of a sudden it started gaining traction as, oh, wait, there might be an issue here where rubella causes complications in pregnancy. And so that's where this idea of the rubella vaccine came from, of course. And it was revolutionary in the sense that it was the first vaccine, once it was developed, that was pushed on people to save other people, because nobody cared about rubella at all, except, of course, for the people that started seeing that connection to a potential pregnancy complication. There was no market for rubella. And also, likewise, there was no market for the measles vaccine because there had been no real hype about it. There had been no seriousness. And I'm going to quote a paper right now because this is where the turning point was for measles, is basically when we made the vaccine. This is when measles became something that we should care about. And in fact, the paper was written by CDC scientists, and they're epidemiologists, and they're talking about how measles really isn't a big deal. And they'd been trying to make a vaccine for years, but it didn't work. And that's okay because we can live with it. They said the morbidity figures testify to the stability of the biological balance of measles during the period. The decline in mortality demonstrates the degree to which we have adapted to this balance, and we have learned to live with this parasite. But then, so what is it that would make someone want to buy a measles vaccine? The short of it is the answer is because we can do it. In that same paper, these CDC scientists say, those who ask me, why do you wish to eradicate measles? I reply with the same answer that Hillary used when he asked why he wished to climb Mount Everest. He said, because it's there. To this may be added, and it can be done. So the reason we have a measles vaccine is because we could do it. It was not something that we were afraid of at the time. But then even after that, the sales were really, really low. So this is why something like that, and also mumps too, it really wasn't outside of the military something that people were concerned with. So now you've got these two vaccines that you can't sell. But then you've got this random scientific paper that much of the scientific communities kind of dismissed and didn't think that there was a connection. So I'm going to back up a step and say, I'm not going to say, I'm not the doctor here, and I'm not going to say that there's never any complications in pregnancy from rubella. We can look at the stats and things like that at a different time. This is just a historical and kind of economic and political commentary on what was going on. So you've got two vaccines that you're not able to sell, and then you see that there's a potential to sell a vaccine to a group of people who are really scared about something all of a sudden, that you can drum up that fear. You're not sure if that fear is real or not. We're not going to do more research yet, but there's a paper that we can hook our wagon to. And then you've got that context of being in the 1960s and the women's movement and that sexual liberation movement going on. So this rubella vaccine actually kind of tied in with all of that. And it started out more about empowering mothers. This is the vaccine that made abortion mainstream, because all of a sudden, a woman who had a pregnancy that she wanted to terminate could go talk to her doctor about this potential complication. And it was now a medical decision that respectable women could make, as opposed to a conversation that you were just having within your family and decisions you were making outside. So they used the medical system to legitimize that conversation. There's a whole bunch more about that, but you just asked me about the schedule. So I'm writing a series of these articles. Actually, we have a sister organization. It's called Health Freedom Institute. So we're publishing all of these kind of deep dive articles on the policy and history behind each one of these. That's how we mainstreamed these vaccine decisions, is because it started out as a military movement. It got wrapped up in the women's rights movement, and it became economic, because then by the time you get around to the chickenpox vaccine, for example, that was another one where people were like, why are we having this? There's no problem with chickenpox. When you look at the congressional record, when you look at the source documents, it's literally an argument about economics, because everyone agreed that it was okay for kids to have chickenpox when they were younger. And there's even evidence and information that having chickenpox as when you're younger, it helps prevent shingles later on. And there was a lot of controversy about whether that was going to shift the epidemiological shift to shingles, which is actually way more dangerous. It's the same virus. But the argument was that now that women are in the workforce, nobody has time to stay at home with their kid for, 2, 3, 4 days because they have to be at work. So if we create this vaccine and we put it to market, then we're going to save money because we're going to let the women stay in the workforce. They don't have to take that time off. And then they also made arguments about cost effectiveness with respect to preventing that illness. And, those are all statistical arguments. So I hope that answered the question.
Well, that's awesome. Now, my doctor told me a similar thing. I expressed some concern. This was several years ago when we had made this decision. We were no longer going to vaccinate, especially our son who was a newborn. And I mentioned, I feel almost like a bad mom. I had done enough research, but the society sees me as a bad mom for not vaccinating my children. And she said, honey, the only reason they vaccinate is because the moms are working and they don't have time to stay at home with their children. That was the first time I'd ever heard this. I'm like, that's a horrible, horrible reason. And she said, honey, it's a good thing that you're home with your children. It's okay if they get sick. We have things to help them through it. She showed me all these natural things. So it is an incredible thing. So you're not the first person to say that. It's an actual deal. Sheila, you want to add?
Yeah. Thank you for that wonderful history. And the issue is, there are interventions that can be made, particularly with the measles. And we're looking at, high dose vitamin A that can be given. And for other viral illnesses, there are interventions that can be made. What they do is they point out the injuries that occur. And if we look at life, injuries can occur at any phase of life. And how do we respect life that has been injured? And so it's very disturbing to, if you've been exposed to the flu in your pregnancy, and there is a risk of damage to the fetus and the baby growing inside of you. However, is our response to that to kill the child? Right? Does the injury, is that a one-to-one correlation? And as mothers, what does that do to mothers when we say, well, this is, we don't want a child that isn't perfect. All right. Well, I haven't met a single perfect parent or a perfect child, but that doesn't mean that we're not all loved and cared for. So they point to the exception, or that, if it's poverty or whatever the reason is, as an excuse to harm the child. And we need to have a medical establishment and a community that says, you're against the odds, but we're going to support you in the process. We're not going to abandon you. And that's where we need to step in as a nation. And I think that is possible. And people need to know that is truly possible. Because as I work with children who are disabled, there's not one of them that I don't love and care for, and that their families don't love and care for them, because they have taught us so much. And we think, well, they're just a burden on society. No, they're actually those who teach us what we don't want to know. They teach us about ourselves and our own vulnerabilities. And they bring our egos down. And that's really important, particularly as a physician. We're supposed to have all the answers. No, we're not supposed to have all the answers. We're supposed to be a guiding force, and that we're not here alone, and that we have to be guided also by the ultimate physician, which is God. And it's only when we make ourselves God that we do, and our practice becomes distorted, that we do harm to the patient.
That is an excellent point, Sheila. We saw doctors trying to be God. We've seen it all along, trying to be God, and we see moms trying to be God. We see attorneys trying to be God. We all can fall into that trap. Sheila, where can people sign up to be a part of this conference?
So they can go to our website at VAMFA.org. That's Virginia Medical Freedom Alliance.org. So VAMFA.org. And on the home landing page, you can click on more information. You can see a list of all of the speakers. So we have 11 speakers for the day. It's a full day. And we're excited for everyone to be there. If you are a student, a college student, you can attend this event for free. You just have to give us your information and upload your student ID. And then the cost for people to register is $60 if they register by tomorrow, midnight tomorrow, March 7th, or it's $70 for the event. It's an all-day event. We begin registration at 8 o'clock and we end at 5:30. So it's a full day, an exciting day with lots of speakers, lots of breaks so that you can talk to the speakers as well as one another about the material that you're hearing throughout the day.
Yeah, and anyone in the vicinity, I hope people think about traveling to this event. It's going to be a lot of information and from really great speakers, including our own Marcus Thornton, Jim Erdman, and Carolyn Rocco, where I'm excited to hear what they're going to be speaking of as well. I appreciated the last conference that I attended from VAMFA last year, that it was not a deal where you were expected to be sitting the absolute entire time. But there was an opportunity at multiple instances to get up and talk with people, to network, to see what these specific organizations at the tables were discussing. I know that we're going to have organizations like the Weston A. Price Foundation there, and what other organizations will be there at the tables?
So the John Birch Society, we're hoping that they're going to be able to come. They're a little packed in their schedule, but Stand for Health Freedom will have a table. Feds for Freedom will have a table. All of us will have all of the speakers. We have the Association of American Physicians and Surgeons, Dr. Erica LeBaron, who their organization has been a leading force for physicians and healthcare providers across this nation for over 20 years, and really advocating for the doctor-patient relationship, advocating for medical freedom. So they are one of the biggest conservative medical organizations for physicians in the country. And to be able to have her as one of our speakers, but to be able to interact with her. So all of the speakers throughout the day will have tables, and we're excited to have everybody there.
Yeah, I'm excited. I'm excited for to hear a complete talk by Valerie on her subject, the history of all of this. It's absolutely fascinating. Well, thank you all so much for joining me today. I have one last question for you. If the average American citizen can do one thing to combat the corruption that we have seen in our country, what would it be?
I think it is returning to our basis and our faith in God first, and then allow God to guide you as you say no to things, and reclaim your power as an individual and as a family so that you are not dependent on the state, local, or federal government for your life and your well-being.
Oh, now I have to follow that. That's the perfect answer, really. I mean, the only thing that I could even think of to add is, listening to podcasts like this, attending conferences like we are going to be at soon, making sure that this information continues to circulate, because, yet again, it's right in that First Amendment that we have. We protect our God-given rights. We protect our ability to speak about them. And that's what we have under our Constitution, our Bill of Rights. And this is the time. This is the time.
This is. Well, thank you both. Thank you, Valerie. Thank you, Sheila, for joining me today. It was a pleasure having you, and I can't wait for the conference April 5th.
Thank you.
I'll see you then.
Thank you.
Thanks so much for tuning in. Please like, comment, subscribe to, and share our podcasts. I'll see you next week.